We're live. So I'll be checking your messages in between, in case you have any queries. All right. All right. So, very good evening, all of you. We'll be discussing the various PYQ questions which have been asked repeatedly in the INI-CET. And without delaying further, let's discuss. Okay. So I'm Dr. Garima Bhambhani, your faculty for the faculty for public health dentistry at Bhatia. Okay. So I teach in the capacity of professor at People's College of Dental Sciences, and I teach public health dentistry with Bhatia. All right. I have 11 years of experience. Will be 12 years this year. Okay. So coming with the first question, which is as per the hierarchy of evidence, which is the highest level of significance, it lies in which of these studies? All right. So coming to the question, out of the options which is given, we have case report, systematic review, cohort, and randomized control trial. So out of these options, it is definitely systematic review and meta-analysis. Okay. From the given options, this is meta-analysis. However, in your options, if you are given the option as clinical practice guideline, okay, in that case, clinical practice guideline will be given the weightage. Okay, so in that case, we will go with clinical practice guideline. Okay, now what is systematic review? We keep talking that systematic review has the highest level of evidence. Systematic review is basically that we are systematically, okay, whatever studies that you are systematically identifying them, okay, selecting them, and you are so for example, you have a topic which is post COVID mucormycosis. Okay, so you are collecting all the articles on that particular topic. Okay, and then we are critically analyzing it. So this is a very stronger evidence. Okay, that is a systematic review. Coming to the other option, what is a case report? So case report is basically you have a single, okay, case report is a patient's medical presentation that you have. Okay, a person has suppose come to you with a particular kind of a skin lesion. Okay, so you describe that in detail. That is a detailed description of the same. Okay, that is called as a case report. Okay, so basically this is a unusual or an interesting medical case. Okay, that might be interesting in some way. Coming to the next option, we all know what is a cohort study. It is called as you select a cohort group. Okay, you select a group of individuals, you follow them over a period of time. Okay, for example, you take a group with a particular exposure, you take smokers, follow them over a period of time to see whether cancer has developed in them or not. Okay, is it clear now? So you take a particular cohort, follow them, and see if cancer has developed in them or not. That is called as a cohort study. Understood? That is cohort study. That is the next option. Then what is a randomized control trial? Randomized control trial is your next option. That this is a type of an experimental study design. Okay, now suppose you give an intervention. Intervention is you're intervening, giving a particular mouthwash or a line of treatment. So when you want to test how effective, okay, to test the effectiveness of the intervention, okay, effectiveness of that intervention is what you do as the randomized control trial. Understood that? Okay. So basically, systematic reviews come at the highest level after the clinical guidelines is that you synthesize the data from multiple studies. So you get to know the validity of those studies. Okay, that is what is systematic review. Okay, now coming to the next question, which is in an epidemiological study. Okay, the first case when you are doing a study, what is an epidemiologic study? You are conducting a survey. Okay, now the first case that comes to you. Okay, what is the first case? The first case which is first documented, okay, that is an index case. Index cases, which is the earliest documented case. Okay, the first case that you document is the index case. Okay, or the first case, suppose there is an infectious outbreak. Okay, so the first case that is identified in an outbreak, okay, that is documented, and first case which is identified in case of an outbreak. Okay, that is a first case. Okay, secondary cases, that people who have come in contact with the first case or the primary case. Okay, first of all, let's understand what is the primary case. Primary case is first individual who brought the infection. Okay, that first that you document is index. Primary is who brought the infection. Okay, that is a primary case. Okay, like suppose first COVID case is the primary case. Okay, secondary is the second person who came in contact with that primary case. So this is basically those who were exposed, okay, through the exposure to primary case. This is your secondary case. Understood this? Okay. Next question is the prevention or the emergence. Okay, now you want to prevent. I'm just checking the live chat also in between to see if there are any queries. Okay, so the prevention or the emergence of the development. Okay, so you want to prevent that no risk factor is eventually developed in that case. Okay, in countries where they have not yet appeared, what is that kind of level of prevention? Okay, so there are various levels of prevention. Okay, what are those levels? Okay, levels are that there is primordial prevention, there is primary prevention, there is secondary prevention, and there is tertiary prevention. Okay, primordial is that you prevent the development of the risk factors in whom that they have not yet developed. Okay, now how do you bring about primordial prevention? That is, you do intervention by mass education. Okay, individual and mass. By giving the health education, you can bring about primordial prevention. Okay, now I will be explaining the various levels of prevention with example and detail, because various MCQs have been asked and I have seen students getting confused. Okay, so basically first is, see, this is your diagram. Okay, first of all, this is the diagram. Okay, now primary prevention is that which is taken care of in the pre-pathogenesis phase. Okay, what is pre-pathogenesis phase? That the disease has started developing but it has not yet manifested in the human being. Okay, that is called as the pre-pathogenesis phase. Okay, so till it is in the primary prevention, it is in the pre-pathogenesis phase. When it is in the pathogenesis phase, the level of prevention is secondary prevention and tertiary prevention. Understood that? So basically, primordial, so this is the natural history of disease. This is the diagram. Okay, till primary prevention is till the pre-pathogenesis phase, and secondary prevention and tertiary prevention is in the pathogenesis phase. Okay, this is what we understand by the various levels of prevention. Okay, now what are the various levels? First is that primordial prevention. Okay, first is primordial prevention. Okay, primordial is that you prevent the occurrence of risk factors. Okay, for example, the health problem that we want to study is, okay, the health problem that we want to study is basically, say, obesity. Okay, we want to study about obesity and hypertension. Okay, and what are the issues we have? Lifestyle is in case of obesity and hypertension is smoking. Okay, physical exercise. All right. So basically, in the pre-pathogenesis phase, the risk factor which is there is, okay, in the pre-pathogenesis is the risk factor. Okay, we want to prevent that the risk factor to in that will lead to formation of that will lead to hypertension is basically obesity. So obesity, the person is not obese in this case. Okay, that is one thing. The other thing is that like obesity, chocolate, snacking, all these things are absent in case of a pre-pathogenesis phase. Okay. Also, the disease is absent. That is, development of hypertension is absent. Okay. Now, if you're talking about a dental example, so the disease that we're talking about here is, say, dental caries. Okay. In this person, the caries is absent, caries is not present, and also the habit of eating sugary sticky substances, okay, that is also absent. So here the risk factor is also absent and the disease is definitely absent. Okay, now coming to what is primary prevention. Okay, primary prevention is basically which is you take an action before the disease occurs. Okay, before the onset. Here you prevent the risk factors from occurring. Here it is before the onset of disease, before disease has started. So that removes the possibility that the disease will ever occur. Okay, so what you're doing is that you are giving the intervention in the pre-pathogenesis phase. Okay, which is that you are intervening the interaction of the agent, host, and environment. Okay, you will give the intervention so that the disease does not occur only. Okay, so how do we attain that? By health education. For example, in this case, risk factor is present. When the risk factor is absent, that is primordial. Okay, so in this case, the person is obese. Okay, the person also has the habit of snacking. Okay, but obesity is present and hypertension in this case is absent. Snacking is present but dental caries in this case is absent. So we will take the health education. We will give them health education so that they do not develop the caries. We will tell them the right brushing techniques. Understood? That is primary prevention. Okay. Now coming to secondary prevention. What do you understand by secondary prevention? That is, primordial says that you remove the risk factor, okay, that is not present. Primary says that you take the action before the disease occurs, okay, onset of disease. Okay, coming to secondary is that you halt the progress. Okay, if the disease is progressing, you halt the progress of the disease at the incipient stage. Okay, that is called as secondary. Okay, for example, the disease is present, which is hypertension is present. Okay, now you want to prevent that hypertension should not progress further. Your aim is that that person should not receive a heart attack. Okay, dental caries, that is the disease is present in secondary prevention. Dental caries is present. You do not want the pulp to get involved. You do not want a heart attack. So in secondary, we will prevent that any progression of disease should occur. Understood? That is secondary prevention. Okay, coming to what do you understand by tertiary prevention? Tertiary prevention is that you do the intervention in the late pathogenesis phase. Okay, what is the late pathogenesis phase? This is the late pathogenesis phase. Okay, So you do an intervention in the late pathogenesis phase. You limit the disability that it will cause and you will rehabilitate. Okay. So basically, what is tertiary prevention? Tertiary prevention is that when the disease has progressed beyond its early stages. Okay. When it has progressed beyond early stages. Okay, that is called as the tertiary prevention. For example, in these cases, okay, the heart attack has already taken place. Okay, now you want to prevent the death or the further complication. The pulp involvement is already there in case of dental caries. You want to prevent the occurrence of periapical abscess or osteomyelitis. Okay, so this is what do we understand by the various levels of prevention. Okay, now I have this diagram for you all. Okay, primary prevention, the person does not have the disease, we take the action before the onset of disease. So this person does not have caries, but it is prone for caries. Okay, secondary is that patient has caries, you do not want it to progress further. Okay, you do not want the pulp to get involved. The patient already has dentinal caries. Tertiary is that you do not, pulp is already involved, the roots are remaining, you do not want it to get further complicated. Okay, you do not want osteomyelitis or anything else like that to develop. Okay, now the ethical principle of doing no harm is termed as, okay, we all know there are 5 ethical principles. Okay, what are they? There's this now one is beneficence. So what is beneficence is that you have to do good to the patient. When you take the oath as a physician, you have to do good. Non-maleficence, maleficence is being malefic. So you do not have to do no harm to the patient. This is what is asked. That is non-maleficence. Okay, this simply stated principle is that do not kill the patient, do not cause any pain, do not cause any suffering. Okay, do not incapacitate the patient and do not deprive. Okay, veracity means you have to be truthful. You cannot tell, suppose if you feel that an implant would be more lucrative for you, but the patient should be given the option of an RPD as well as an implant. Okay, so you have to be truthful to the patient. Confidentiality is that whatever confidential information that you know about a patient, you have to keep that to yourself. Okay, you do not have to discuss that with anyone else. Understood? The next is which diagram. So this is a question from the distribution of data. Okay, so how we definitely express the data in various forms. Okay, so which diagram is obtained by joining the midpoints of the histogram blocks? Okay, so suppose these are your histogram blocks. Okay, this is your histogram block. Okay, all right, now these are the midpoints. Okay, you joined this. All right, you joined this. The graph that you will obtain, okay, will be a frequency polygon. Okay, that will be a frequency polygon. Okay, so this is a frequency polygon. This is the diagram of the frequency polygon. Okay, this is representing, this first part is representing the age by the prevalence of dental caries of the age group of 5 to 9. Second is 10 to 14. Third is again, this is misprint. Okay, so you joined the midpoints and this diagram that you made is frequency polygon. This is a pictorial representation. Okay, like different frequencies. These are the frequency of dental caries. Okay, so you're representing in a picture format. So to draw that, first you make a point over the midpoint and then you connect them with a straight line. Okay, so this is the representation of a frequency polygon. Okay, now identify the probe with the correct markings. All right, So we all know that CPI-TN probe has a band, black band from 3.5 to 5.5 and the markings at 8.5 and 11.5. This is what a CPI-TN probe looks like. Okay. So CPI-TN probe is what it is also called. The other name people get confused is also called as the WHO periodontal probe. Okay. The other name of CPI-TN probe, I'll write it here, is CPI-TN probe is WHO periodontal probe. Okay. This has basically a black marking. Okay. This is what the probe looks like. All right. This has a black marking which is starting at 3.5 and it is extending till 5.5. Okay, and there are additional markings at 8.5 and 11.5. Okay, now the CPI-TN probe was designed for two purposes. Okay, what was the purpose of a CPI-TN probe is? One is basically that one of the purpose was you want to measure, okay, like the periodontal pocket. So you want to measure the depth of the pocket. Suppose if the probe is getting immersed till here in the pocket, so you will estimate that the pocket depth is about 4.5 mm. Understood? And also to detect the subgingival, so calculus which is present subgingivally, okay, that is usually detected with this ball, okay, which is 0.5 mm. Okay, the purpose is basically to detect the subgingival calculus. Understood? Now this probe was first described in what year? By, this was first, why is it called as the WHO probe? Because this was first described by WHO, okay, and it is called as in TRS 621 in the year 1978, same year as what? Alma Ata Declaration. Okay, now there is another question which was asked, that what is the weight of the CPI-TN probe? The entire weight of the probe is just 5 grams. Okay, and there is a color coding. All right, this is from and that ball tip here is basically 0.5 mm, which the reason why it has a ball is because when you put it in the pocket, it should not damage any of the soft gingival tissues. Okay, this is basically the diagram. So this was a question which was asked in your NEET, and we had covered it in our PhD. Okay, they said that how much force is used. So maximum of 20 grams is used. How do you assess the force? You put it in your fingernail and assess for it. Okay, so when you will see the recall, you will see the various subjects and at what time what subject recall was there. So if you see in PhD, the same question we've described nicely, and the maximum force with which that we have is 0 to 20 grams. Okay, now there are two types of CPI-TN probe. Okay, again very nicely explained in your recorded and live lectures more in detail. Okay, so there are two types of probe, which is CPI-TN-E and which is CPI-TN-C. Okay, E probe is for epidemiological surveys. Okay, the purpose of this is it is used for your epidemiological survey. Okay, now for this just has a black band between 3.5 and 5.5. C is for the purpose of clinical. Okay, so this will have an additional marking at 8.5 and 11.5. Okay, the purpose here is to record deep pockets for the purpose, okay, if there is a complex periodontal treatment and additional lines of use. Okay, that is the purpose of the clinical probe. Understood? Next is incineration is done for all. Okay, what is it done for? You incinerate or you burn off completely. Okay, what will you incinerate? Something which cannot be reused and which should not be reused and which is highly infectious. So what will that be? Can a human anatomical waste be reused? Human tissue? No. A cotton soaked with blood? No. Sharps, again, yes, they can be. Cytotoxic drugs should be destroyed. So incineration is done for all except sharps. Okay, what is the waste sharps or the needles? As we know, what are they? They are the needles, they are the syringes, the scalpels, blades. They can cause punctures. Okay, so basically they have to be closed off in puncture proof white bags, and they are mainly disinfected, or they are autoclaved, or they are given the chemical treatment, or there is a process called as shredding by which the needles are destroyed so that they do not puncture or cause any infection. So they are not incinerated. Okay, this is a table which describes the various types of waste. So you will see that the category number 2 is incinerated. What does category 2 indicate? That is basically animal waste, the organs, tissues, body parts, bleeding parts, any animals used in research, waste generated by veterinary hospitals, discharged from hospitals, all this is category 2. This is incinerated. Human anatomical waste is also incinerated. Okay. Whereas cytotoxic drugs, which is category number 5, 1, 2, 5, okay, all the medicines, discarded medicines, they are incinerated. Okay, and okay, category number 6 is which is contaminated with blood. Okay, anything which has blood on it, that is also incinerated or autoclaved. Okay, now what is okay, now this particular thing which is your disinfection. Okay, category number 4, this is what they have asked, which is category number 4 is basically your waste sharps, that is syringes, blades, glass. Okay, all these things are disinfected. You chemically treat them and you disinfect these things. Okay, that is called as the category number 4. Okay, now what do you do? Human anatomical, so you know about the various categories of. Okay, so again, human anatomical waste, animal waste, they are stored in plastic bags, but if it is a microbiological waste, you have to or it is a sharp waste, then you have to put it in puncture proof bags. Okay, so I hope you all understood this. Okay, coming to the next question. In a study done, so this is a study, again pay attention, because many of you ask me this query and you get confused in this. Okay, so this is basically when you do a study on say you do a study to assess the efficacy. Okay, you want to check the effectiveness of a drug. All right, and in diabetic patients. Okay, so you are measuring. Okay, so here you are measuring the efficacy of a drug. Okay, and you are seeing that what is the level of HbA1c, and you are assessing HbA1c before you gave the drug and after you gave the drug. Okay, the patient is the same. Okay, what test is to be applied? Okay, again, I hope you know the answer. In this case, the answer would be paired t-test. Okay, why it will not be unpaired t-test and it will be paired t-test? The answer is very simple, because paired t-test is when the observations are the same, right? When the observations are on the same individual, that is where you apply the pair t-test. That is, the sample is the same. Okay, the patient is the same. You are taking before a pair of observations from the same individual. Okay, that is from the same sample. Okay, the answer here is same sample. Okay, same sample, pair of observations. Okay, that is when you have a pair t-test. Okay, unpaired t-test is when you apply it to a pair of independent. Suppose you were checking the effectiveness of drug in A group of people and B group of people. Okay, so that is when you would do unpaired. They were unrelated to each other, they are independent observations. Okay, that is when you apply the unpaired t-test. Understood? That is unpaired t-test. Okay, so paired t-test is when you give a pair of observations. Okay, so the answer here would be paired t-test. Okay. Coming to the next question, which is, yeah, to evaluate the caries incidence. Again, if we are talking about incidence here, in 10-year-old school children in a city, which study design would be appropriate? First of all, what is the other name of incidence study? The cohort study. Okay. The other name of cohort study is called as incidence study, or it is called as forward looking study, or it is called as a prospective study. Okay, this goes from cause to effect. Okay, so basically what happens in these individuals is that you take these people who are free from the outcome. Okay, they are exposed to a particular disease, to a particular risk factor, and you observe them over a period of time. Okay, so this is incidence. Incidence is the new cases in whom the disease is not yet developed. Okay, so that is an incidence study. So you want to take these school children and you want to see that whether caries will develop in them over a long period of 10 years. No, sorry, they are 10-year-old. So this is, they've not mentioned the duration. So you want to see if caries will develop. They do not have caries as of now. You will observe them over a period of time. That will be the incidence study. So this is prospective. The answer will be A only. Okay, this will be the answer. Understood that? So the participants are free from the outcome. Here the children do not have dental caries. They are free from dental caries, but they will be observed over a period of time. Understood? The next question is principle of Lagarde's involve. Okay. Now this was a question which was asked in your INI last year. Okay. What is principle of Lagarde's is these are the people who are basically they have very firm health belief and they do not believe in adapting to any interventions. Okay, what happens in these people is that these are called as Lagardes because basically okay, so yeah, these are Lagardes. Okay, Lagardes is nothing but these are the people who are highly resistant. Okay, they resist change. Okay, they resist being changed. Okay, and they delay, they do not adopt the behaviors easily. Okay, they are not very good at adopting the behaviors. Okay, and firm health belief is that they are very rigid to the attitudes about behaviors, and they try to spread health behaviors or innovation, and they will try to delay. Okay, that if they have to adopt a health practice, basically they are resistant to change and they will delay to adopt the behavior. Okay, because they feel that they are not very receptive. Okay, and they are resistant to change because they do not perceive the current health issues as a threat. Okay, or maybe they have a mistrust in the healthcare system. For example, some people are just against allopathy, you will see, so they will not take medicines only. Okay, or they will not undergo that treatment. They will think something will happen to the patient. Okay, so this is the problem. All right, with those people, they will not adopt new methods and they will resist the change. Okay, so basically this is what we understand by this concept. Okay, now the next option is that you might get confused between what is guided health programs. So guided health programs is not related to changing people adopt things. It is just a method in which you are focusing on the strategies. Okay, like strategies to implement whatever health programs are there. You are focusing on how to implement those health programs. Okay, that is called as a guided health program. Okay, Now, basically, non-adoption, you understood that, right? What is laggard and what is so why they can be resistant? Because some people also have some cultural beliefs. Okay, they believe that, you know, like there are so many people, especially villagers, they will think that they do not need to take allopathic treatment for cancer. They will simply follow some Ayurvedic methods. Okay, or they will go to some religious, you know, uh, not praying, but they will think that you know, doing some rituals would help them reduce or get over the disease, and they do not need to take the treatment. Okay, so these are all ingrained beliefs. Because of them, their beliefs are very strong and they will not adopt. That is Lagarde's. That is the principle of Lagarde's. And this is the theory of firm health belief and non-adoption. Understood that? Okay. Now, the next question is here, if a disease is spreading to multiple countries, okay, in a short period of time, it is called as, okay. So when we are talking here, we are talking about what? COVID. Okay, for example, COVID spread to multiple countries. So what do we call COVID? We said it is a pandemic. Okay, when a disease is spreading to multiple countries in a short time, it is called as a pandemic. Okay, so here what is a pandemic? It is something which is spreading to various countries. Okay, it is widespread. That is a pandemic. Understood that? Okay, the next is the option A is sporadic. Okay, so what do you understand by sporadic? Okay, sporadic is something which is scattered in nature. Okay, which is scattered, that is, the cases can occur haphazardly from time to time. Okay, and from time to time they are distributed in different time frames, like suddenly at some point it will appear, at some location it will appear. Okay, so there is no common source of infection. That is called as sporadic. So SS, scattered. Okay, next option that you have is endemic. Now, what do you understand by endemic? Pandemic is what? Countries. Okay, and sporadic is scattered. Endemic is constantly present. Okay, something which is constantly present in a particular area. Okay, in a area. Okay, that is endemic. Okay, what is hyperendemic? This is hyperendemic. Okay, now what do you understand by hyperendemic? Hyperendemic is it is constantly present in a particular area, but similar to this, but that area has high incidence, okay, or low prevalence rate, and it affects all age groups equally. Okay, that is hyperendemic. Okay, now this is the next question is from the chapter Health Economics, explained very nicely to you all in your Health Economics chapter. Okay, so what is this? This is you are assessing the outcome. Okay, whenever a program is conducted or an economic evaluation is done, it is done into various categories. So here the outcome is assessed in terms of labor, how much labor you invested, what was the cost, and how much time was invested. Okay, so this is called as cost benefit. Why? What are the various options, and what do we understand by that? Cost benefit is that how it is basically in terms of money that you are calculating. So how much cost was there in implementation divided by the benefits, okay, to quality of life. Okay, what is cost utility? Cost utility is basically the cost of implementation upon the number of tooth surfaces that were carved. Okay, cost efficiency is cost of implementation upon saving in cost of treatment. Okay, so basically about benefit, what you need to remember is that benefit will be that suppose you invested in a program. Okay, you invested in a caries control program. So how much of your money got saved? That will be cost benefit. Okay, Now, if less people suffered or anything else, where you are not measuring in terms of money, that is cost effective. So in healthcare programs, many times monetary benefit is not seen. But when you assess in terms of monetary reasons, it is called as, in terms of monetary categories, it is called as cost benefit. Okay. Next is, an orthodontist uses fluoride varnish, okay, and fluoride mouth rinse, okay. Now what he's doing is, before applying brackets, okay, to prevent, he is taking the intervention before white spots on teeth during the treatment. What kind of prevention is this? Risk factor is already present, which is ortho treatment. So definitely that intervention would be primary intervention, which is you prevented the initiation, you prevented white spots from occurring. So prevention before initiation of the disease, okay. Just as we understood right now, this is called as primary prevention, okay. In primary prevention, there are two interventions by which you can take primary prevention. That is health promotion, okay. You can promote the health of a subject and you can specifically protect them, okay. How do you do health promotion? That is, give health education, okay, give safe water, give proper nutrition, okay, give lifestyle modifications, and specific protection is give them water which is fluoridated, okay, provide fluoridation water, and pit and fissure sealant. This is also an MCQ. Pit and fissure sealant, specifically sealing the pits and fissures so that they do not lead into caries, okay. This is called as specific protection. That this comes under primary prevention in specific protection. If you see my recorded lectures or live, you will see that pit and fissure sealant is a specific protection which comes under primary prevention. You're specifically sealing the pits and fissures so that the caries does not develop, okay. Next question is loss or disease, okay, present due to congenital birth defect, okay. This is called as impairment. Why? I will explain. This is in your concept of health, okay. Now what is impairment? Impairment means basically any loss, okay. The definition of impairment is any loss or abnormality, okay. You experienced any abnormality which is in the form of psychological reason, okay. It could be physiological loss or it could be a loss of an anatomical structure, okay, or suppose some function is lost for a person, okay. That is called as impairment, okay. Now what is disability, okay. Disability is that because of the impairment there is some restriction, okay, or there is lack, okay. Lack is a lack of performing an activity, okay. A person is not able to perform an activity, okay, in the which is considered normal, okay. That is disability, okay. Coming to the next is handicap, okay. So impairment is any loss or anything which is abnormal, okay. Suppose in a person's structure. Disability is that because of the impairment you cannot perform a particular activity. Handicap is a permanent disadvantage, okay, which is that the role that is expected out of a person is not being fulfilled. That is called as basically handicap. So the sequence, that is basically the sequences: impairment leads to disability and that further leads to handicap, okay. Coming to the examples, if a person has had an accident, okay, if a person has met with an accident, this will be suppose a disease, okay. Loss of foot, due to the accident a person has lost, there is a loss of a structure, okay, that is impairment, All right. So this is extrinsic or intrinsic. Now, because of the impairment or the loss of foot, the person cannot walk. This will be called as disability. Okay, that you cannot walk as much. Okay, now because he cannot walk, he lost his job. He's unemployed. So he's suffering the disadvantage. This is the handicap. Understood this example? Okay, so here loss or disease present due to congenital birth effect is called as impairment. Okay, next question is what is mode? Mode is the most repeated value of the sample. Okay, all these three, okay, these are the measures of the central tendency. Okay, what central tendency is? The middle values around which the values are located. Measures of the central tendency. Okay, what are the measures of central tendency? They are arithmetic mean. Okay, arithmetic mean, there is median, and there is mode. Okay, these are the measures of the central tendency. What is central tendency? Central value. Suppose you have 10 observations, the central value around which other values are distributed. Okay, so basically the objective of this is that you want to measure, condense the entire mass of data, and you want to facilitate the comparison. For example, you have the values such as 2, 3, 4, 4, 6, 4, 9, 8, 7, 6. What will be your mode? The mode here will be 4. Why? Because this is the most commonly occurring value. This is mode. Okay. Okay, coming to the next one, which is universal immunization program does not include. So this is a fact-based question. The universal immunization program includes measles, DPT, and BCG. The HPV vaccine is not included in the UIP or the universal immunization program. Okay, let's try to remember this. The UIP or the universal immunization program. Okay, following vaccines are covered in this. It has BCG, it has DPT. Okay, it has OPV, which is oral polio. It has a polio vaccine in it. Okay, it has diphtheria, it has pertussis, and it has tetanus toxoid. Okay, and it also has a measles vaccine in it. BCG is bacillus. Okay, bacillus calmette guerin. Okay, so these are, there is B, there is DP, there is OP, and there is M. Okay, so there is something like maybe, you know, Borden. Okay, yeah, something like this you can remember in UIP. Okay, like DPT, BCG, BD, Bod M, something like that. Huh? Mod B, like modern boy, you know, UIP, something like that. Okay, I try to come up with more mnemonics. They are on my page, PHD by Garima. Okay, so from time to time. All right, so these are the main vaccines in it. We also have hepatitis in it. Okay, so we have tetanus toxoid, we have JE vaccine, and we have HIB. So these are mainly the common ones. HPV is definitely not included because, you know, for HPV there is a different vaccine which is used, which is also for the cervical cancer. Okay, so now these are the 5 R's of smoking cessation. What is the correct sequence? Okay, so let's try to understand that why do we follow this particular sequence. The 5 R's are basically these. Okay, they are relevance. Okay, how do you help a person quit tobacco? So we will tell them that why it is relevant. Okay, why it is important that you quit tobacco. Okay, first you have to explain before you go into what are the risks and everything else, that why you should quit tobacco, what is the relevance, how it will improve your life, what it is doing to your finances, to your life, and to your health. Next is risk. If you continue using tobacco, what are the risks that you will feel, that you will come across? Okay. The next is rewards. If you quit tobacco, what are the rewards of quitting? Okay. What are the benefits of quitting that you will come across? Okay. After that, the roadblocks. Roadblocks is what are the, when you try to quit tobacco, what are the blocks that will come your way? Okay. Next is again go to repeat these habits. Okay. These are basically the 5 R's. Relevance is you encourage the patient to indicate why quitting is relevant. Okay. Risk is tell the negative consequences. Reward is that you tell the person that if you quit, what are the benefits that you will get, what are the benefits of quitting. Okay. Roadblocks is you identify what are the barriers that are coming your way. And repetition is basically every time the person visits a clinician, the person has to be, it has to be repeated to an unmotivated person in every interaction so that it seeps in deeper. Okay. Now this is the next question is the amount of time, okay, that has lapsed between the initial exposure, first time you have been exposed to a disease, and next is its detection. Okay. What is that period called? This is the latent period. Okay. Like the usual time of diagnosis and the initial detection. Okay. This is called as the latent period. Okay. Why? Because especially in case of a, say, like there is usually a time, right, when you have been when the disease has started and when you diagnosed it, so that is the latent period. Okay. Because especially in an infectious disease, when you were infected, okay, and when it developed, that period is pretty long. Okay. So that is when it becomes infectious. All right. That is called as a latent period. Okay. So when basically so you understood that? Okay. Now, which of the following will lead to selection bias? Okay. Now, in this question, the question says that you selected the individuals, what will lead from a university, okay? And you ask them, university is fine. Telephonically, you're asking individuals, that will not lead to bias. Questionnaires, no. Okay. Selection of participants from a dental hospital. Yes. Selection bias. What is first of all selection bias? Again, very nicely explained in epidemiology by me. Okay. Selection bias is the bias that you do. Bias is basically what, when you're conducting a study, the error in that study is a bias. Okay. So when you're conducting a study, suppose the bias that occurs during collection of a data, during in the way you select an individual or you select the participants from a hospital. Okay. So that will be basically selection bias, that there was a discrepancy while selecting. Okay. So now people who were visiting the hospital, they might be having some dental problem. Okay. That could be due to caries. So you selected the people from the same population who are already having some dental problem. You did not select an individual which was not previously exposed. So this is taking the individuals from the hospital who already had a dental problem is a basically type of a selection bias. Okay. A similar question, which bias is caused due to different rates of admission? This was a question, again, you should go to the recall and you should click on the various subjects given below, go in PhD. You will see this exact question was asked in your PhD NEET. We covered all questions in your notes and exams. So this exact question was asked, which is Bergsonian bias. This is due to the different rates of admission. Okay. So this type of bias was given by Dr. Joseph. Okay. Dr. Joseph Bergeson. Okay. He gave this kind of bias, and this is called due to some people are being admitted to the hospital at, this is also called as admission rate bias. Okay. That is a Bergsonian bias. Okay. That is basically a bias. Now, what is selection bias? Selection bias occurs when what happens basically when the study population, like the people that you're taking, for example, you took the subjects from the same hospital, so they are not truly representative. What you want to measure, okay, they are not representative of that particular problem, okay, they are not representative of what you are trying to study, okay, of the general population. The next one is memory bias, okay. So the next one is memory or recall bias, okay. Memory or recall biases, that suppose you're asking questions from a person and they are not able to recall, okay, the history that you're telling, they are not able to recall the answers properly, okay. So that is called as a memory bias, okay. What is interviewer's bias? That is the person who's interviewing. For example, I already know that this is a smoker and he will have oral cancer, so the way I will ask the questions, it will be affected. This is called as the interviewer's bias. When the interviewer knows that what is the hypothesis? Smoking causes cancer. So this is a hypothesis that we are going to test, okay. We've learned about what is null hypothesis, okay. So he knows that who are the cases are the people who already have cancer, right? So this is basically called as the interviewer's bias. We have covered the various kind of biases in your epidemiological study, okay, in detail. All right. So as you know, we are all very open to your doubts and we answer your queries till you're satisfied. So if you have any queries, the chat section is on. Please let me know. Any queries? So in this 1 hour, whatever I could cover, I tried to cover as many questions as I could and explain you some concepts. I hope at least some questions were clear. I would request you all to see all the GTs in detail and attend all the live classes so that you benefit the most from it. Okay. Thank you. Have a good night.